Good afternoon, everyone. Welcome. My name's again Anita Levels, one of the Civil Rights Outreach Coordinators here at the Pennsylvania Human Relations Commission. And we have a treat today. Not only do we have Dr. Valerie Arkoosh, but we have our Executive Director, Chad Lassiter, who is here, who is going to do some opening welcomes and introductions. Hello, Executive Director
Thank you.
Lassiter.
Thank you so much, Anita. Good afternoon, everyone. Welcome to this virtual space where we're humbled and honored to have our secretary here, as well as all of you, for Medicaid Matters, helping Pennsylvanians with disabilities have a choice and achieve independence. Hope that everyone's doing well on this Monday. May you have a superb and phenomenal week throughout. And without further ado, I'm going to throw this social justice baton back over to Anita Levels to introduce someone who most of us who are in this space admire and we've learned from. I know I have as a board of trustee at the St. Christopher's Hospital of Children over the past 10 years, and to have her here in our Commonwealth at this time, at this pivotal stage in our democracy is such a blessing, and we're very, very fortunate. So without further ado, Anita, thank you for allowing me to be in this space. PHRC staff and everyone else, welcome to this virtual PHRC Lunch and Learn.
Thank you, Executive Director Lassiter. And once again, welcome everyone. And we want to welcome Dr. Valerie, our secretary, Dr. Valerie A. Arkoosh. PHRC invites you to join us for a virtual lunch and learn featuring Secretary Dr. Valerie A. Arkoosh, Pennsylvania Department of Human Services. Valerie A. Arkoosh, MD, MPH, was appointed to the lead of the Pennsylvania Department of Human Services by Governor Josh Shapiro on January 17, 2023. She completed the nomination and process and took office as secretary on June 29, 2023. As a physician and public health professional, Secretary Arkoosh was at the center of Montgomery County's efforts to combat the COVID-19 pandemic, leading a data and science-driven approach to the unprecedented challenge. Arkoosh's leadership was praised during the county's response, especially her transparency and public communication throughout the pandemic. Secretary Arkoosh is also a staunch advocate for maternal health and reproductive rights, and she previously served on the Pennsylvania Maternity Mortality Review Committee. Prior to stepping into public service, Secretary Arkoosh was professor of the clinical anesthesiology and clinical obstetrics and gynecology at the Perelman School of Medicine of the University of Pennsylvania. Arkoosh is a graduate of the University of Nebraska College of Medicine and received a Master's of Public Health from the Johns Hopkins Bloomberg School of Public Health. She performed her residency at Jefferson Medical College in anesthesiology with a special focus in obstetrics. She has an undergrad in economics from Northwestern University. Secretary Arkoosh lives in Springfield Township, Montgomery County with her husband and 3 children. Please welcome Secretary Arkoosh.
Good afternoon, everybody. And Anita, thank you so much. And Executive Director, thank you so much for inviting me to join this wonderful group of people today to share some thoughts and talk with you about what is going on in our Medicaid program with a focus on individuals with disabilities and the work that we do to ensure that they have personal autonomy and agency and choice and are able to live as independently as possible. So the goal here today is to save some time to ask questions and have more of a conversation, but we will get started. We'll jump right in if that's all right and go through just some kind of level set and update on some of the work that we're doing here at the Department of Human Services. So I thought it might, particularly in this moment where our Medicaid program is the target of substantial cuts based on the Republicans' reconciliation or budget bill that was passed in July. So I thought this might be a very good time to just level set on Medicaid and how important Medicaid is to folks all across the Commonwealth. Right now today, Pennsylvania's Medicaid program covers approximately 3 million people. 1.3 million are children. Over 423,000 are individuals with a disability. 312,000 are older adults, 65 and up. Almost 10,000 are veterans, and 26% live in rural counties. It's really important to understand and remember back, as I'm sure many of you do, prior to 2015, here in Pennsylvania, our Medicaid program was what was considered a traditional Medicaid program. And the only way to get covered through Medicaid would be if you were a parent or typically a mother of a child or made less than 100% of the federal poverty level. But thanks to the Affordable Care Act, we had the opportunity to expand Medicaid here in the Commonwealth. And under Governor Wolf, that took place in 2015. Since that time, we now cover 750,000 plus individuals because of that Medicaid expansion. But that's just a point in time count. Since 2015, we have enabled a little over 2 million people to get coverage through Medicaid when they needed it because of that ability that was made available through the Medicaid expansion. Very importantly, hospital uncompensated care has been reduced by almost 28% since Medicaid expansion. The corollary of that is we've cut the uninsured rate in Pennsylvania in half. It was about 10% prior to Medicaid expansion, and now it hovers right around 5%, depending on the month of the year. So we have made tremendous progress in the Commonwealth to ensure that everybody has access to health care. Next slide, please. So this map just gives you a sense of where people are in who are enrolled in Medicaid by county. And you can see that the enrollment rate varies by county, and you can see the percentages along the bottom. So for instance, those blue counties, 21 to 30% of the individuals who live in those counties are enrolled in Medicaid. And you can see there are some geographic variations in who is served by our program. If you're interested in learning more about the Medicaid program, we have a substantial amount of data available to the public at dhs.pa.gov/data. And there you can find lots more maps, just like the one that you're seeing on this slide. We have information on Medicaid by county, by age of enrollees, by legislative districts, whether it's the U.S. Congress, the state Senate, or the state House. We have certain information about diagnoses, disabilities, and more. So for anyone who's interested in really understanding our program and what the potential risks are to our program from this federal HR 1, as it's called, or the Republican budget bill, all of that information is there, and it's a great way to educate yourself, your friends, your neighbors about what is at stake here. Next slide. So let's jump into a little bit more information about the history of disability services in our Medicaid program. Historically, and I know that there'll be folks on this call that remember this, institutionalization was the only option. And it remains a required option within Medicaid. In other words, if you look at the federal requirements in the Medicaid program, institutionalization must be an option to care for people with disabilities in the Medicaid program. People with disabilities were often sent to residential facilities during childhood for ongoing care, and many of these children spent their entire lives in these institutions. By the mid-20th century, these institutions were overcrowded. They were often very poorly staffed and very poorly maintained. There was very little actual treatment going on in these settings in many cases. And it was really just not the way that any of us would want to live ourselves or have any of our loved ones or friends or family live in a way that many of these institutions provided care. So in the 70s, there was increased attention on institutional quality and advocacy for greater inclusion, and very importantly, community-based resources and supports for people with disabilities. In the 1980s, we saw the first waivers that were established to allow for Medicaid to pay for long-term services and supports in the community through home and community-based services waivers. And I just want to talk about that word waiver for a minute, because I think when people hear it, sometimes it's a little confusing. What these waivers are is a waiver from the requirement of offering institutional care. So before the waivers existed, the only care that we could pay for in Medicaid was institutionalization. What the waivers allow is, in our case, the Commonwealth, to use Medicaid dollars to pay for care outside of an institution. And in this case, particularly for individuals with disabilities, that means being in the community. And so the programmatic work is called Home and Community-Based Services Waivers. So these waivers have allowed us to dramatically expand options and to really enable people to choose where they want to spend their lives with the services that they want for the first time. Next slide. So in the 90s, the Americans with Disabilities Act was passed, and of course that prohibits discrimination based on disability. Individuals with Disabilities Education Act expanded supports for children with disabilities in public schools, and both of those two things helped continue this movement towards community-based services and making sure that individuals with disabilities are fully included in our communities. There was a very important case during the 1990s. We frequently refer to it just as Olmstead, and it was a Supreme Court ruling that under the ADA, under the American with Disabilities Act, unnecessary institutionalization is considered discrimination against people with disabilities or with mental illness. So the Olmstead decision set the precedent that states should pursue community-based placement first through these waiver programs, and that institutional placement should be a last resort. In the 2000s, federal law and policy continued to expand supports available to states to support that community-based care and transitions from institutional settings to the community. And it also, there were also many provisions that continue to improve and define quality standards in community settings, because obviously it's extremely important to make sure that these services are high quality. So today, if you look around the country, nearly 87% of Medicaid recipients who receive long-term services and supports are able to access these supports in the community. And we're really, really proud of this shift in our programs. Home and community-based services spending accounts for nearly 65% of Medicaid long-term services and supports expenditures nationwide. Next slide. So here in Pennsylvania at the Department of Human Services, we work to provide care and support for Pennsylvanians with disabilities, and this primarily occurs through two different program offices within the Department of Human Services. So while these two offices have different deputy secretaries, I do want you to know that we work together very, very collaboratively, because there definitely is some overlap in the work that goes on in these two offices. So first we have our Office of Long-Term Living. Our Deputy Secretary for that office is Juliet Marsala. And the OLTL oversees long-term services and supports for adults with physical disabilities and older Pennsylvanians who are dually eligible for Medicare and Medicaid. And what that means is, as many of you know, when you turn 65, we are all eligible to receive Medicare. But for individuals who are very low income, they may also qualify for Medicaid. And so that those individuals are called dually eligible. They qualify for both Medicaid and Medicare. And in some cases, people with certain disabilities can qualify for both, even under age 65. But the vast majority are 65 and older. And the services to these individuals who are dually eligible in Medicare and Medicaid are provided through the Community Health Choices program. So that is all run through our Office of Long-Term Living. Then we have our Office of Developmental Programs. The Deputy Secretary in that office is Kristen Ahrens, and that office oversees home and community-based services and institutional services where necessary for Pennsylvanians who qualify for Medicaid coverage because of an intellectual disability or autism. Now, the Commonwealth does still operate two state centers, which are Pennsylvania's two remaining what are called intermediate care facilities, and they are specifically for adults with intellectual disabilities or autism, and they are residential settings. Many people that are in these remaining two centers have been there most of their lives. I think the average length of stay tends to be, around 40 to 50 years. And so this harkens back to what I talked about in the history, that many of these individuals were placed at these centers or one of our other centers. We've actually closed a number of them as this work has shifted to the community. But many of these individuals are in these centers, and it's really the only home that they've known. And so I do want you to know that we are actively always working with individuals who want to transition out to the community. But for some individuals, they do remain in the place, which has basically been the only place that they've known as home for their young adult or adult lives. But we're very proud of the fact that we are in a situation where the vast majority of individuals are now residing in the community, and we have very few individuals coming into the centers at this point. It's not zero, but it's very, very low numbers of individuals, and the circumstances tend to be very unique because we've been able to do a really strong job of serving people in the community. Next slide. So we're going to kind of switch back a little bit back and forth between these two different offices. So now I'm going to go back to talking about our Office of Long-Term Living, which oversees community health choices. And again, that's the entity that coordinates services for people who are in that dually eligible Medicare and Medicaid population, and adults who are younger than 65 but have a physical disability that qualifies them for Medicaid. So CHC, as we abbreviate it, first started in 2018. It currently serves almost 389,000 Pennsylvanians. The goal of CHC is to support opportunities to live in the community. So when CHC started in 2018, 58.5% of the population was served in the community. And today, I'm very proud to tell you that we are up to 76%. In fact, I think we're actually up to almost 78% right now today in 2025 that are served in the community. So we've seen just tremendous growth and increase of individuals being served in the community. In this program, if you're not being served in the community, then it is likely that you are in a nursing facility of some type, some kind of nursing home. In order to be eligible for the services in Community Health Choices, you have to be considered nursing facility eligible. And what that means is that you have physical conditions that require enough assistance that you would qualify to be in a nursing home. But because of Community Health Choices, we are able to provide those services and supports so that people can stay in the home that they love or in the community that they love. And we have been just really successful in doing that. So just to kind of go through the work that this office does, the office provides oversight of Community Health Choices and LIFE, which is another one of our managed care organizations that provides home and community-based services programs. The office provides oversight of eligibility determinations for Community Health Choices. This is done by an independent enrollment broker. So again, they are independent. They're not part of any managed care organization or directly part of DHS in any way. So it truly is independent. So everybody gets a fair assessment. And as I mentioned, in order to be in CHC, you have to have conditions that would otherwise enable you to go into a nursing home for your care. Another very important role that this office serves is oversight of the nursing home transition program. So for individuals that are in a nursing home, if they would like to transition back to the community, that is the service that we provide, and the nursing facilities are required to participate and be part of that. So again, it's all about putting the individual first and their desire to live where they would like to live. The office oversees policy and program development and management around these programs, provides financial oversight, and of course, runs a number of quality improvement initiatives. Next slide. The department's Office of Developmental Programs, and again, this is the office that is working with folks with intellectual disabilities and autism, currently serves 59,000 Pennsylvanians. And ODP's work includes oversight of county intellectual disability offices, as well as that clinical eligibility process. ODP has a set of waiver programs within ODP, so they manage and oversee those waiver programs. They do a lot of services planning for individuals with intellectual disabilities and autism. Sometimes the needs are quite complex and change over the lifespan of the individual, and so they are very actively involved in service planning. They also do policy and program development and management, provide oversight, financial oversight of these programs, and have a number of quality improvement initiatives. One example of that is we are currently transitioning to a performance-based contracting model for our providers so that they are incentivized to provide high quality care and also incentivized to care for some of our most complex individuals who desire to live in the community. We do currently have a waiting list for services in the ODP program. Unfortunately, this is very common in the United States. Almost every state, I guess we have about 40 states at this point, do have a waiting list for services for individuals with intellectual disabilities and autism. And that is largely related to the fact that Medicaid funding has limitations on it. Next slide. However, this issue of this waiting list is something that Governor Shapiro has really prioritized. And I am so proud to tell you that with his leadership and the support of the General Assembly, during the 24-25 budget, the governor was able to achieve historic funding to these programs that serve our friends and family and community members with intellectual disabilities and autism. So what happened in that budget was a couple of things. One was there was a substantial investment made in the rates paid to the service providers, and that was allowed the service providers to pay higher wages to the direct support professional staff who actually are the ones that literally come into people's homes and provide the services that enable them to stay in a home. We also are well underway in restructuring how waiver funding is allocated to counties to encourage greater flexibility and serve more people efficiently. This is something that I was a very strong proponent of. I was a county commissioner for 8 years, and the way the money would come to the counties for distribution was very, very regimented. And sometimes you'd have too many people for one waiver and not enough people for a different waiver because you have to have certain qualifications to get one waiver or the other. And you were just stuck. There was nothing you could do. Now we are working with counties to manage to a budget, a total budget, rather than a certain number of slots, so that if one waiver is oversubscribed and another waiver is undersubscribed, there is now a mechanism to treat all that money more as a single pot coming into the county. So the counties have the flexibility that they've been asking for years to use their funds in the most targeted and efficient ways to serve the individuals in their communities. So it's really exciting. And the governor firmly said, we want to set a course here to end the adult emergency waiting list in Pennsylvania. Next slide. And so we are absolutely on our way. Are we able to play the video, Allie? Okay, we're going to play a little video here for you.
From the time a child with disabilities is born, you're preparing them for the day that you're no longer here to care for them. I just need the tools to be able to do it. And I really feel like this governor's listening. I'm Cindy Jennings, otherwise known as Matt's mom. What's your name?
My name is Matthew Jennings. I am 30 years old. I like to write and draw, go on driving adventures, meet new people, and use my iPad.
That sounds about right. And who's this?
Mom.
Yeah, Mom, otherwise known as Judy Smith. Matthew was probably the most wanted baby ever. I was so excited when I learned I was expecting him. It was definitely a surprise that the doctor told me he was born with a chromosome abnormality, and they suspected he would have intellectual disabilities and physical disabilities. I heard all that, and I thought, I just want him to know what it is to be happy. Do you remember when we went there? And we went up to the Capitol, and you, me, and Mom. Oh, look, that's when Governor Shapiro came over to the table and talked to us. There were two main things I talked to the governor about: my frustrations of trying to find staff. I know I need to transfer Matt's care to other people because I'm not going to live forever. When I don't have support staff, my mom, Judy, is my backup, and she's 86. It's not a viable plan of care at all. I've spoken up to my representatives and senators and was told that we have to have a balanced budget every year, but you're balancing the budget on my back, and I really think we can do better. I felt that Governor Shapiro really listened to me. He asked great questions. I know he wants to improve the pay rates for support staff.
Imagine if this was your kid, if you couldn't find the services that they need and found out the only reason why a caregiver isn't available is because they're not getting paid a decent wage because the state refused to raise our rate. So let's make this the year we get it done for Cindy, Judy, and Matthew, and the thousands of others like them across Pennsylvania. Let's do this work together.
At the end of the budget address, I felt heard. I finally felt heard. He gave this issue names, faces, a location, but now it's up to the legislature to do the right thing. I'm hopeful for Pennsylvania's future because Governor Shapiro listens.
The Jennings are incredible human beings. I've had the privilege of spending time with them myself, and really, you just couldn't have better advocates than that. And that was the budget. So thankfully, we've made a lot of progress thanks to those budget investments. It was a historic investment in the budget that year. And since that announcement, I'm very happy to share with you that in just a year and a half, a little over a year and a half now, we've seen a 28% decrease in the adult emergency waiting list. Thanks to that increase in wages to direct support professionals, allowing counties to have that flexibility to use every penny that comes into those counties to go right back out the door to serve people. And I also mentioned earlier that performance-based contracting, we're starting to see that because we're really incentivizing our providers to do this work well, more people with intellectual disabilities and autism gaining employment opportunities. We really support competitive integrated employment for everyone who is interested in that. We're seeing increased consistency of health risk screenings, improvements in incident reporting, and this is one of my big ones, 30% reduction in citations for abuse and neglect. So it just goes to show you that when you get the right people putting the right attention on a program that has really needed just a few important changes and some dedicated funding, we can make just a world of difference in the lives of Pennsylvanians who are really depending on us because they don't have anywhere else to turn to get the help that they need, particularly if they want to continue to live in the community. Next slide. So I just always want to remind folks, and particularly the folks on this call, that progress comes from advocacy and persistence. We are where we are today because there have been decades of work, and it's part of why I shared that whole timeline with you. It's not always super quick, but it is that persistence and that resilience and that refusal of giving up that lets us finally make progress. And some of that progress has been incremental, and then we get kind of a big jump in progress like we've seen over this last year and a half. But all of it comes from the fact that people are advocating, they're speaking up for themselves, their loved ones, their family members, and how important that advocacy is. Inclusion is a policy choice. And I want to underscore that it is still not the default at the federal level. The federal Medicaid rules say that the default choice is institutionalization. And so to have the opportunity to live in the community is a policy choice. And to have the waivers that we have and to promote home and community-based services in the way that we do, those are policy and budget choices. And as we face the future with a lot of potential threats to our Medicaid funding, I just want to remind everybody that institutions are the only requirement in Medicaid. Home and community-based services are not a requirement federally in this program. So advocacy and support for this work is more important now than ever. I want you to know that this Governor Shapiro, myself, and my entire team here at the Department of Human Services, we are in this fight every single day. And our fight will always be to enable people to make the choice of where they want to live and spend their time in the communities that they love, with the family that they want to be with, or others that they choose to live with. That is always going to be our priority. So thank you. Again, I want to just put that website up. So that's our general website, dhs.pa.gov. If you want more information about our Medicaid and SNAP programs, which is our food assistance program, you can go to that website /data. And with that, I think we're happy to take any questions. Yeah. Thank you all.
Thank you, Dr. Arkoosh. Appreciate you. That was amazing. Really great stats there. We appreciate you being here again with us today. We don't have that much time. So if there are any questions, we put the questions in the chat. Read the questions here. We may potentially have. Thank you for speaking on, still waiting on some questions to come in. Thank you for speaking on the potential impacts and what we can do to advocate for the state of Pennsylvania versus federal. So thank you for that. So important.
So I'm going to jump in on that first question from my friends at the Pennsylvania Health Access Network. I've worked with FAN since a long time ago when I first met all those folks when we were working to get what became the Affordable Care Act passed. We all worked together. I was leading a national organization of physicians at the time, and we all worked together to get support for the Affordable Care Act. And I can't underscore how important the work that they do is in collecting stories. So please, take that request seriously. The stories that they were able to share, they find people to come in person, to do media events, to do work on social media. It is very impactful here in the Commonwealth. So if folks do have stories that they'd be willing to share, please do reach out to our friends at FAN and get hooked up with them. They can even provide training and other help so that you can be the most effective in the telling of your story, because those stories are going to be more important than ever right now.
Thank you for mentioning that with FAN. Yes, they do the consultations. They help with all types of enrollment with not just Medicaid, but all types of enrollment
That's right.
throughout the state of Pennsylvania. It's really great. Right. Let's see what we have here. Medicaid cuts. Someone has a question. What will be the cuts with, I guess I'm assuming HCBS with Medicaid cuts look like? Someone's
Yeah.
living the CLA providers any longer not able to support them. What does that look like within Pennsylvania?
So that's a good question. So right now, under this bill, the bill that was passed in July targets individuals who are in the Medicaid expansion population only. And so that is adults between ages 19 and 64. And currently, if you have a disability such that that qualifies you to be in Medicaid, you are not in that expansion population. You are in traditional Medicaid. If you are in any of our waiver programs, you are not in that expansion population. You are in traditional Medicaid. So on the surface, this bill, HR 1, the Republican budget bill, does not target individuals with disabilities. However, we are concerned and are really looking at potential secondary impacts. For instance, many of our direct care workers who provide care for people in their homes with physical disabilities, and our direct service providers who provide care in homes for people with intellectual disabilities and autism may be Medicaid recipients themselves or SNAP recipients. And those folks, because they're working, would potentially be in that Medicaid expansion population. There are some potential changes around waivers that I don't think are going to be an issue in the near term, but they aren't directly targeting this particular community. Of bigger concern, though, is down the road, starting in 2028, if this bill is implemented as it was passed, our Pennsylvania Medicaid program is looking at approximately $20 billion, that's with a B, in cuts beginning in 2028 over that next 10-year period. And those cuts could have devastating impacts on our program. It will deeply impact hospitals in particular, but it could impact our entire program. And so while there's not an immediate concern for this community, we are looking down the road at anything that threatens that amount of funding to our Medicaid program is a threat to every person in the program, potentially.
Thank you. Thank you for that impactful information, Dr. Arkoosh.
And that is why actually these stories and helping people understand how important these programs are so important right now, because there's still time to avert those cuts. 2028 is a few years away, and there's already been some discussion of rolling some of those cuts back at the federal level. And this is all at the federal level, not at the state level. So, our hope is that perhaps we'll see a much less of an impact on our programs.
Right. Well, because of our time, we're ending today at 12:45. We want to definitely make sure that we have some of our announcements later on. Director Griffin, we want to make sure that you get space to come in here too. But Dr. Arkoosh, thank you once again for being with us today. But Director Griffin, I guess we can address that later, but I want to just tell you, everyone, thank you so much. Executive Director Lassiter, would you want to say anything? I don't want to put you on the spot, but I didn't want to say anything without you.
No, it's okay. Thank you so much. Great presentation, Secretary Arkoosh, and looking forward to sharing it with my practicum class this upcoming semester at Westchester University Undergraduate Division of Social Work, because there's a lot of macro, meso, and micro implications, certainly. Want to lastly thank everyone for being here. And once again, this will live on our PHRC YouTube page. So once again, thank you, everyone. And thank you, Secretary Arkoosh.
Thank you all so much. I really appreciated the opportunity to talk with you today. Take care.
Thank you.